Hello, and welcome to TTM Academy, or Targeted Temperature Management Academy. This online program is designed to support healthcare providers in critical care, cardiology, emergency medicine, and other fields, improve their care of patients through the use of targeted temperature management, an important technique that has been shown to improve survival and outcomes following a number of critical illnesses, including and in particular cardiac arrest care. Now, this course is important because the diseases we're going to be talking about are of crucial importance to the way we take care of the critically ill in hospitals around the world. So first, why is cardiac arrest so important, and why should we care about ways to improve care? Well, cardiac arrest is a leading cause of death across the world. And I show you a picture here of the general public to remind everyone that cardiac arrest happens abruptly, suddenly, and strikes hundreds of thousands of people in the United States and millions across the world. The other important thing to know about cardiac arrest is that less than 20% of patients with cardiac arrest are discharged alive from the hospital. So an enormous number of people who go into cardiac arrest die either in the field or after initial resuscitation, but then go on to die during hospital care. So the way we as hospital providers take care of these patients is vitally important. Now, it's also important to note that cardiac arrest strikes people in their 50s and 60s. I say that because there is a pervasive idea circulating among the public and among healthcare providers that cardiac arrest is essentially something that happens at the end of life. That cardiac arrest strikes the aged and infirm, people in their 80s and 90s, and perhaps better not to think about resuscitation. But in fact, when we look epidemiologically at out-of-hospital cardiac arrest, it strikes people in generally good health, people in their 50s and 60s. These are people who are going to work, taking care of their families, and then suddenly they collapse with few warning signs or symptoms, and immediately an emergency response has to be organized. Now, assuming someone is resuscitated from cardiac arrest through actions such as CPR, the use of automated external defibrillators, and other actions, patients are brought to the hospital. And then it's our job as healthcare providers in the hospital setting to institute post-arrest care, which includes targeted temperature management. Now, why is this so important? Well, studies have shown, and I show you just one example here, that when you build a bundled care approach that includes targeted temperature management, as well as other modalities of care, such as cardiac catheterization, careful blood pressure management, glycemic control, a state-of-the-art bundle of care, you can greatly improve survival from cardiac arrest. And in this study in 2007, it was dramatically shown that an instituted bundle of care, including targeted temperature management, could greatly improve survival to discharge. And in this course, we'll be covering the clinical evidence supporting this therapy in the bundle of care, including a number of very important randomized trials that have shown the power of targeted temperature management to improve outcomes. So in summary, high-quality CPR, AED use, and then high-quality post-arrest care can save lives and improve outcomes. That's why we're all here today talking about these therapies and why hopefully you'll be taking this course. Now, why do we need a course on such topics? Well, studies have shown that post-cardiac arrest care is delivered in a variable fashion across the world. So in hospitals in the United States, hospitals globally, we struggle with how to institute post-arrest care, and we struggle with the best ways to use targeted temperature management. This is despite very strong guideline recommendations for the use of TTM and this bundle of care approach. It's really difficult. Why is it difficult? We'll be getting into that in Module 1. But one of the real challenges that underlies all this, we have learned, is there's poor access to post-arrest education. That education is crucial, and practical education that doesn't delve deep into laboratory science or pathophysiology, but provides physicians, nurses, and other providers with practical information that they can apply to be champions for post-arrest care. That content has been sorely lacking, which is why we've developed this course, and hopefully you will find it useful. Now, the other issue is that when hospitals have developed protocols for post-arrest care and targeted temperature management, And when hospitals have instituted a system of champions to represent this therapy and help provide training, there's a need for refreshers. The science is changing. New studies are coming out all the time, and indeed, we'll be covering a number of new late-breaking clinical trials in our content during this course to review the latest evidence for TTM and post-arrest care. Champions need these refreshers. And so hopefully, those of you who are taking this course in that role of hospital champions will learn some new things and refresh yourself on the science and practical implementation of targeted temperature management. So in summary, post-arrest care is challenging. It's a complicated, multidisciplinary action, and it's always evolving, and so training and education is a crucial thing for all of us to consider, and we will be going through this course looking at it from the aspects of physicians, nurses, the cath lab, and the critical care environment, to name a few. Now, why trust us to deliver this content? Well, I'll introduce myself. I'm Dr. Benjamin Abella. I'm the director of the Center for Resuscitation Science at the University of Pennsylvania, where I also teach emergency medicine and a practicing emergency medicine physician. In the context of this course, it's important to share with you that I have researched, studied, and taught post-arrest care for 15 years going now, and I've worked with many hospitals across 4 continents to help them establish post-arrest care programs and protocols. So this is truly a passion of mine, and hopefully, therefore, the content I share with you comes from a place of great experience and conviction about how to use this therapy, and also our local experiences here at the University of Pennsylvania, where we've provided post-arrest targeted temperature management since 2005. Now, it's also important to share with you that we ran a course in Philadelphia, a live course known as HEART, the Hypothermia and Resuscitation Training Program. And that live course, which involves simulations, small group discussions, and you see here on the right some photographs from prior iterations of our course. That course really taught us a great deal about how best to deliver this content, and also the great need from physicians and nurses and others who do hospital care to learn about this therapy, to discuss this therapy, and improve their implementation. So I can also tell you that our center, the Center for Resuscitation Science, is singularly focused on cardiac arrest and post-arrest care. So this is what we do all day, every day. And we're passionate about improving survival, and we're passionate about helping you, our community of providers, to improve care at your hospital so that you can improve cardiac arrest survival rates and improve neurologic outcomes following resuscitation. Also, we're passionate about sharing with you other uses of targeted temperature management and casting this in the broader context of critical care medicine. Now, it's important to share with you this course will not endorse any industry products. I am not being paid personally, nor do I have equity in any industry partners that sell products for critical care or post-arrest care. We will strive to present objective science and unbiased treatment recommendations that are consistent with American Heart Association, European Resuscitation Council, and other guidelines for cardiac arrest care. All the proceeds from this course will go directly to supporting programs at the Center for Resuscitation Science, including our training of new young physicians and nurses to study and improve cardiac arrest care, also to help provide free CPR training for low-income communities, and to develop the science of new approaches and state-of-the-art of post-arrest care. So know that any fees you provide for CME credits in this course will go directly to improving our care for patients after cardiac arrest. Now, to give you a sense of the course, in this iteration of the course, we will have 8 modules that will cover what we believe to be the key topics in post-arrest care. These include such things as an overview of cardiac arrest, what happens pathophysiologically after resuscitation, the evidence behind TTM, some practical aspects of how to implement TTM, and so forth. So you see the 8 modules there. And the goal of a modular program is that you can take this at your convenience. You do it all in one sitting. You can do it over multiple days. Each module will be about 15 to 20 minutes long, so they'll be very digestible. And over the series of modules, you hopefully will be well equipped to be a champion at your hospital. Now, With this introduction in mind, I now welcome you to join us in the course. The first module will be an overview of cardiac arrest itself. And this is important to set the stage for the more in-depth discussions of post-arrest care. We'll go through the questions of what is cardiac arrest and what is the overarching framework for saving lives, from CPR all the way through post-arrest care and discharge from the hospital. So hopefully you'll join us, and together we'll improve care for patients after cardiac arrest and save lives.